What systems or processes have made the biggest difference in running your private medical practice more efficiently?
So I think there's a couple of things that has really helped me with building up my private practice. I think just bearing in mind when you are setting up a private practice, it's quite easy to kind of be very enthusiastic at the start and expect lots of things to happen quite quickly. But just giving time, getting yourself kind of registered with the appropriate insurance providers, that often will be the first step to getting your patients booked in. And also then being more available. I think for myself in East Midlands, I think registering with Spire, Leicester, and Nuffield in Leicester, but also exploring other options around Leicester makes my kind of practice more available. And I think that's definitely helped me through those big hospitals bring in more patients. So I think that was the key for me. But I think looking to the future, I think there's only so many patients that will come through those channels, and being able to explore other areas such as social media, Google, and those kind of formats means that I think those patients will continue to kind of increase in size as I grow my practice.
So I wanted to ask about sort of financial literacy. What are the biggest financial misconceptions medical consultants have when starting private work?
So I think for me, it certainly was around what is the indemnity cover involved in private practice, because the kind of that experience had very limited experience of private practice, and nobody really talks about it in the NHS. And it's something that I had a few of my kind of close colleagues who were quite open about their private practice, and they were able to say that, look, indemnity doesn't exponentially increase for certainly in my area of pediatrics, and that I was able to have an honest conversation with my indemnity provider to say, look, how much is my indemnity going to increase when I start to do more private practice? And I think it was helpful because the way they do it was, as I increase my private practice, as my revenue increases, so does my indemnity cover, the cost of my indemnity cover. So I think that was a big misconception for me that probably was a bit of a hindrance for me to start up my private practice. But once I was having those conversations, I think that was helpful in giving me a clearer idea going forward. Other kind of misconceptions, I suppose, was kind of the admin side of things. So how much administration that I need to be doing. And I think it's in this day and age, I think you do have a lot of support. And I think, for example, even thinking about administration support using AI pathways to make things easier. So processes where AI kind of does a lot of my scheduling, deals with a lot of the straightforward queries like where can I get more information, uh, and linking to my website. So I think those things certainly have helped me with not being overrun with all the administration burden that you might expect with building up a new private practice.
Do you think private medical practices adopting AI early will have a competitive advantage? And what do you think that competitive advantage is?
Absolutely. I think that's something that we are using much more commonly, and our patients are using that much more frequently. So if we aren't in tune with kind of what's available and how to best use that, I think we're going to probably fall behind, and our patients going to not appreciate kind of, there's going to be a bit of a gap in terms of how we approach our patients. So firstly, I think most patients will have Googled and maybe chat GPT their condition, and they'll come up with some information that they want you to be able to kind of support them through. So actually having used AI myself kind of for kind of a lot of my administrative tasks, I kind of know how that side of things works, and I'm able to kind of better support my patients that way. In terms of kind of how it helps me in my kind of everyday practice, I think a lot of my invoicing, a lot of my scheduling tasks are managed by AI. And I think that really helps me. There is a balance, obviously, because of the privacy and concerns regarding patient confidentiality, which means that I am limited by how much I can use AI. But I think that landscape is changing and is going to probably change massively over the next 5 to 10 years, where the NHS itself in England are using much more AI generated kind of support software to actually make things easier for clinicians. And I'm seeing that in my own NHS practice, And I'm probably adapting that similarly in my private practice.
In a field like pediatrics, trust is everything. How do you communicate your expertise online without sounding salesy?
So I think it's a really good question because there is a quite a fine line and a fine balance between giving out information and providing the support to my patients without kind of overly selling myself and coming across as, look, all this doctor wants is for somebody to come and see him and pay him consultation costs. But actually, I think there's a lot of work out there that's needed for patient support. And I think we are probably in the UK, we find that a lot of our kind of emergency services are inundated because that support services aren't available. So for example, I do work in children's emergency department, and we see that we have a lot of patients coming in that really didn't need to be coming to the emergency services, could have been managed by their pharmacist, could have been managed by their GP. And actually providing some of that information means that there's a lot of information available for patients who can then make that decision, and families to make those decisions about what actually my child needs. And if they are unsure, or if they've done those steps, then they can kind of move on to the next step, which might mean seeking more help from more professionals like GPs or myself, and they can come and see me. But actually giving that information means that they are empowered to make that decision themselves. So I think that's certainly something that I would suggest, that I think giving information in an honest manner and giving parents the opportunity to make a decision means that we have a better relationship when they come and see me, because they have been through that process, and then they kind of know where I can help them, and it's easier for me to then help them through that journey.
Many medical consultants rely only on hospital profiles or referral networks. What made you want to invest in building your own online presence?
I think I just felt that limiting myself to referral processes through kind of colleagues and GPs means that in this day and age where patients want to be able to take that next step quite soon, they already have maybe Googled or searched on ChatGPT to say, look, this is the symptoms that my child has, and these are the things that I'm worried about, and they already want that next level of care. And limiting those patients to having visited the GPs means that there's a delay in them actually getting the information they need. So therefore, in my practice, I'm happy to see patients who are self-referred, and therefore they can kind of quickly get on that journey of finding out actually what's going on, and finding a solution to their child's problems. And I think that's why I think being visible out there online means that patients can contact me directly, get information, and then I have a strong team of administrative staff that support me with kind of answering those queries about, look, Dr. Husain deals with this and he deals with this, but he actually doesn't do this. Because again, it's very tricky to navigate the landscape of private care, especially if patients don't really know what a doctor can do. So for example, for myself, I'm a general pediatrician, but I have a lot of experience dealing with pediatric cardiology, pediatric allergy. So I do see a wide range of patients, and having the ability of kind of doing that in my day-to-day practice in the NHS means that I have a lot of experience in managing these patients, and I can kind of support them also in my private practice.
So, what's one mistake you made early in your private medical practice journey that ended up teaching you a really valuable lesson?
So I think for me, and being honest about kind of through my journey, early on, I kind of had some patients, or particularly one patient that comes to mind, that needed strong pain relief to manage their aches and pains that they had. And they had been through several different professionals before me, trying to understand kind of what was causing their pain and trying to manage their pain. They were already waiting for other referrals, such as the pain team, support within the NHS, but those services can be a long wait in the NHS, and I think sometimes even up to a year of waiting on a referral pathway. And coming to see me, I kind of did a thorough assessment of their issues, and then I suggested that, look, a lot of their pain was multifactorial. For example, yes, there might be some musculoskeletal problems. So the muscles and ligaments might be causing some pain, but a lot of it will be an overlay of how they're feeling, their mood, their stress levels. And all those aspects come into play when you're dealing with complex pain. So for me, I kind of did suggest that we need to kind of concentrate on that side of things. But when you're starting to talk about pain and needing strong pain relief, there are systems in place in the private sector as well as the NHS, which means that controlled drugs or strong pain relief in children is very strongly controlled, and therefore being able to kind of suggest that, look, I can increase the dose, or we can increase the strength of the medication that we're managing for pain, means that we have to be able to kind of do that effectively and really safely. And sometimes in the private sector, that's a little bit more tricky, because there's a little bit of a disconnect between us as a private clinician seeing patients, the GP who will be kind of working along the NHS system, and then having the right support services to manage this patient who actually needs physio, mental health support, and all of those things. So again, not promising my patients too much to start off with, because again, I'm not going to cure their pain instantly. They've been through several different professionals and they've kind of come to me because they're really struggling, but being honest with them. So I think I kind of learned that quite quickly, that, look, I have to be honest. I'm not being able to sell them any magic cure. I work in the NHS just as I work as a private clinician, and being able to give them a clear understanding that, look, their journey is not going to be easy, but I'm here to work with them to get to that process. And yes, we need to be cautious about using strong pain medication. We need to be kind of careful of the controlled drug regulations that are available, and then supporting them through their journey to recovery, really. So I suppose that was something that I learned quite early on in my private practice.
When it comes to attracting self-pay patients, what matters more, visibility or messaging?
I think it's a complex question, and I think there isn't a straightforward answer for that, Abe. Just thinking about the self-pay patients that come and see me, yes, I needed to be visible, and therefore they've found me and they felt that I could help them. But also the messaging that is generated before they come and see me sets expectation for what they are likely to kind of the experience that they'll get in clinic. And I think if if the right messaging isn't in place, sometimes their expectations are a bit unreal. And therefore, I think not only being visible is important, because coming to see me is not the end of that journey. It's actually the beginning of a journey for myself and my patients. And actually, what I want is to get them towards the end, where we are in a place where we understand their problem and find a clear solution for them going forward. So actually being visible, getting them kind of to come and see me, but sending that right messaging out is I think both of them are really important in having a successful private practice.